Alzheimer's disease. What is Alzheimer's disease? Alzheimer's is a type of dementia that causes problems with memory, thinking, and behavior. Specifically, it is a neurological disorder in which the death of brain cells causes memory loss and cognitive decline. It is classified as a neurodegenerative type of dementia. What? Some basic facts about Alzheimer's. It is the most common form of dementia. It is not a normal part of aging. It also worsens over time. Currently, there is no cure, although treatments for symptoms are available. Alzheimer's symptoms. 1. Worsened ability to take in and remember new info, such as repetitive questions or conversations, misplacing personal belongings, or forgetting events or appointments. 2. Impairments to reason, complex tasking, exercising judgment, such as poor understanding of safety risks, inability to manage finances, or poor decision-making ability. 3. Impaired visuospatial abilities, such as inability to recognize faces or common objects or to find objects in direct view. 4. Impaired speaking, reading, and writing, such as difficulty thinking of common words while speaking, or speech, spelling, or writing errors. 5. Changes in personality and behavior. For example, out of character mood changes, including agitation, less interest, motivation, or initiative, loss of empathy, and compulsive, obsessive, or socially unacceptable behavior. Causes of AD. There are two abnormal structures called plaques and tangles, which are prime suspects in damaging and killing nerve cells. Plaques are deposits of a protein fragment called beta amyloid that build up in the spaces between nerve cells. Tangles are twisted fibers of another protein called tau that builds up inside cells. Though most people develop some plaques and tangles as they age, those with Alzheimer's tend to develop far more. They also tend to develop them in a predictable pattern, beginning in areas important for memory before spreading to other regions. Scientists do not know exactly what roles plaque and tangles play in Alzheimer's disease. Most experts believe they somehow play a critical role in blocking communication among nerve cells and disrupting processes that cells need to survive. It's the destruction and death of nerve cells that causes memory failure, personality changes, problems carrying out daily activities, and other symptoms of Alzheimer's. Unavoidable risk factors. Age. The disorder is more likely in older people, and a greater proportion of over 85-year-olds have it than those 65 years old. Family history. Having Alzheimer's in the family is associated with higher risk. This is the second biggest risk factor after age. Having a certain gene puts a person depending on their specific genetics at 3 to 8 times more risk than a person without the genes. Numerous other genes have been found to be associated with Alzheimer's disease. Being female, more women than men are affected. Potentially avoidable or modifiable factors. Factors that increase vascular risk, including diabetes, high cholesterol, and high blood pressure. There also increase the risk of stroke, which itself can lead to another type of dementia. Prior head injury. While traumatic brain injury does not necessarily lead to Alzheimer's, some research links have been drawn with increasing risk tied to the severity of trauma history. Sleep disorders, the breathing problem sleep apnea, for example. Diagnosing Alzheimer's disease involves checking neurological functions, for example, by testing balance, senses, and reflexes. Also, carrying out standard medical tests, such as blood and urine tests, to identify other possible causes. Performing brain scans, such as CT or MRI, to distinguish Alzheimer's from other possible causes for symptoms like stroke or tumor.